Hello, everyone. We're going to give people a chance to join the webinar, and then we will get started. We've got, the numbers are furiously rising. And let's see. Hey. All right, we've got over 75 people already, and we had over 200 people register for this, so we're very excited. Let me go ahead and get us going. Hello and welcome to the Myositis Association's Empowerment Clinic webinar series. TMA's empowerment clinics are designed to enhance the quality of life for those living with myositis and their care partners. Before we get started, a few housekeeping notes. Today's webinar is being recorded and will be available on the TMA YouTube channel by June 1st. And you will also receive a follow-up email with slides. And I'm just so excited. This speaker went above and beyond and created an exercise video for us. So that will be included. And if you've got any questions whatsoever, you can put them in the Q&A box at the bottom of your screen. And then also we have a webinar survey that has been attached to this webinar. It will pop up on your screen when you leave the webinar, and we would really appreciate it if you could take a few minutes and fill it out. I am Rachel Bromley, TMA Senior Manager of Patient Education Support and Advocacy, and today's topic is lifestyle medicine. We are so excited about this. The actual full title is Inflammatory Myopathy, Integrating Lifestyle Medicine to Optimize How You Feel with Neha Bhanusali, MD. Lifestyle medicine focuses on using evidence-based lifestyle interventions such as diet, exercise, stress management, sleep optimization, and avoidance of risky substances to improve health outcomes. So to present on this topic, it is my honor to introduce Dr. Neha Bhanusali. Dr. Bhanusali is an associate professor of medicine and a triple board certified integrative rheumatologist. She explores how diet, mindset, sleep, exercise, and stress impact inflammation in diseases like gout, inflammatory arthritis, myositis, and lupus. By combining allopathic and complementary approaches, she provides holistic, personalized care. And her training includes a residency at Mt Sinai West and a rheumatology fellowship at Columbia Presbyterian Medical Center in New York. She has been practicing as an academic rheumatologist for more than 10 years at the University of Central Florida College of Medicine. Dr. Welcome, and thank you for sharing your expertise with us today.
Thank you, Rachel. I'm really excited to be here. And lifestyle medicine is actually a passion of mine. So yes, you can see I'm a traditional rheumatologist. And I kind of got into this because people used to ask me, let's say 4 or 5 years ago, even, could anything in my life change my autoimmune disease? Is there something that I could be doing, to make a difference? And my answer really was like, no, because there really wasn't any evidence for that. And we want to have data out there, not just say, take this supplement, do this, and you'll get better, right? It's really about what is the evidence out there. And it is trickling in. It's really slow, especially for myositis, but it's there. I mean, it's coming out, and I think it's exciting to see that there's maybe something else that we could contribute towards this. So I'd love to talk about inflammatory myopathies. And I know people that are already on this know a lot about myositis, unfortunately, because they're either dealing with it or they're a caretaker for somebody with myositis. So I'm not going to cover too much in terms of deep medications and all of that. And I know you guys have talked about that, but I do want to touch on some things because I think it does influence how you do overall. So if we go, and Rachel's going to be my slide mover because I was having some IT issues.
Absolutely. I'm going to share. Let me get it in slide presentation. Can you see it?
Yes.
It looks great. Thank you so much. And also, you guys, feel free to talk with each other in the chat. Let us know where you're tuning in from. We've got people from all over the nation and beyond, and we love to hear where you're from. So please let us know in the chat and put any questions you have for the doctor in the Q&A. So go ahead, just let me know whenever you want me to advance the slide.
Okay. So first of all, inflammatory myositis, right? This is very important to know. It's a little bit different. When you talk about myopathies, there's so many different causes. I mean, it could be from the thyroid, it could be from drugs, medications, it could be genetic. There is a genetic component to it. But what we're going to talk about is the idiopathic inflammatory myopathy. Idiopathic means we don't know. And we sometimes know the cause, like a statin cholesterol medication, but a lot of times with this condition, we just don't know what causes it. Maybe we'll know years from now, but right now we're going to assume that it's not really something that's obvious. Next slide, please. So the main focus of this talk is myositis from dermatomyositis, polymyositis, the statin-induced one, which is immune-mediated necrotizing myopathy, inclusion body myositis. And you can also get myositis as part of other conditions. For example, we certainly see it with lupus kind of as an overlap syndrome or scleroderma, and some other conditions as well. Next slide, please. And the reason that this makes a difference is that we don't know which muscle groups are going to be involved. It kind of depends which one you have. For example, are the deltoids involved? So when we talk about proximal muscle, you might have heard your rheumatologist talking about that. It means that our muscles that are kind of close to the spine. So it means kind of like the top over here, the deltoids, for example, could be something that's of concern. But if you have IBM, inclusion body myositis, a lot of times the deltoids are not actually affected. And it might be more forearm. So over here, and you get some atrophy over there, or finger flexors. There's a famous musician who has IBM, and it's tough, using and playing the instruments with the finger flexor issues. So it does matter which one you have. Next slide, please. And it's important to think in the back of our minds, and this is part of the overall picture. Does your risk of dying increase? And I think that's a question that we really would love to know the answer to, but it really depends case by case. As a broad generalization, I can say for IBM, inclusion body myositis, that for the most part, it should be similar life expectancy to not having it, except in some caveats. For example, if your swallowing is affected and you tend to aspirate and your food is going in the wrong pipe, and because of that you get a pneumonia, yes, that can increase your chance of, sickness and possibly, early mortality. Otherwise, something like, if and so pneumonias are one cause, but also balance is a big thing. For IBM, balance can be off and falls are an issue. Imagine, for example, hypothetically, as you get older, you get a condition called atrial fibrillation, and somebody puts you on a blood thinner. And on top of that, you have IBM. So your balance is off and you fall and you get a brain bleed. So these are other factors that could put into play. So even though you're theoretically supposed to have a similar life expectancy, it doesn't necessarily work out always, but overall you should, which means what should be the cause of death? Probably the same as everybody else. Cardiovascular disease is still the most common cause of death. And so we want people to live long and we want them to die of normal causes. Not die at all, but if that's what's going to happen. Now, polymyositis, dermatomyositis, necrotizing myopathy are different. For those, it could be a course where you have mild disease and you kind of just always simmer along, or it could be you have a lot of disease up front and then you kind of get over that hump, medications calm it down, and you never have another flare. Although most people tend to have little flares here and there, but sometimes our medications also cause a lot of issues, and that can definitely impact your life, your lifestyle. Necrotizing myopathy is tough. That's the one that you get from cholesterol medication, statins, sometimes not even from a statin. And that one, could do a lot of damage. Even MDA5 is another kind, which we definitely worry more about future, how long you're going to live. And some people will have a normal life, but it's something we do worry more about. Next slide, please. So does it matter when you hear your rheumatologist talking about antibodies, which antibodies that you have? When I first started practicing, there were no antibodies that I could get. somewhere along the lines, I was like, wow, this is actually available from Quest. This is amazing. I can order this panel. And at first, we didn't know what this panel meant. We just ordered them. Somebody would be positive for this and positive for that. And we weren't sure how to interpret that. But it's good to know what you have. So if nobody has checked your myositis antibodies, it is definitely worth checking because we focus more on certain things. For example, the TIF1 gamma antibodies, we look harder for cancers. We know in dermatomyositis, for example, that there is a higher risk of cancer. So we will search for it. But perhaps, if I have somebody that has that antibody versus maybe a different antibody like MI2, then I might search a little harder in the TIF1 people when something is just not looking right. And then if somebody has MDA5 antibody, I'm going to be looking more for lung involvement and kind of maybe screen them more often than I would another person. JO1 antibody, I mean, having that, you could get this rapid lung disease in a pretty severe course. So you want to be careful with that. So it does kind of matter a little bit which antibody you have. Next slide. And so I think one back from there.
Did you say to go back?
Yes, so go back one slide. Because I have another one here.
It may
I
be
think you went forward.
forward and
Yeah, it's not going back.
is this a slide you need?
No, it was right before the lifestyle medicine. So before these color blocks. Yeah, so the one after this.
Okay.
Okay, yeah,
There
that
you
was
go.
good. Does the patient feel better? Okay, so you see this graph. This is where a rheumatologist is. We check your inflammation markers, we give you medication, and the numbers are hopefully coming down. The sedimentation rate, your C-reactive protein, your rheumatologist feeling good, okay, when these numbers come down. And yet, a lot of times my patients are like, but I don't feel better. Well, maybe I feel a little better, but I still don't feel great. So there's this disconnect, right? That your doctor feels like they're doing a good job, they're treating this condition, but you may not feel well. So that's where I think lifestyle medicine really comes into play. So now next slide, and we can talk about lifestyle medicine. So lifestyle medicine has been this kind of new, I would say, new discipline within medicine. And it's almost, I think of it as the opposite of rheumatology, because here I am, I give so many medications. I give biologics, disease modifying medications, steroids, anti-inflammatories, like I feel like a pharmacy when I'm just giving people medications. And lifestyle medicine is the exact opposite. It's using your lifestyle to improve your health. But I think it's really important, especially if you have a rheumatic disease, you have an inflammatory condition. So you can't just say, hey, I'm going to follow this lifestyle and my disease is going to go away. I wish it was that easy. And if it is, and if that works for you, wonderful. But you have to keep in mind the amount of inflammation your body has. It's not the same as when somebody gets hurt, they get a cut and they get an inflammation because that area is healing, it's red hot tender, it's getting better. This is different. This is your entire body's involved. And we know with inflammatory disease processes, that inflammation is wearing away at other areas. We know from lupus studies, rheumatoid arthritis, that it increases all that inflammation increases your risk of heart attacks and strokes. So you don't want to just live with inflammation. So yes, we want to do lifestyle, but we want to kind of also make sure that the disease process has calmed down. So if we look at the 6 pillars of lifestyle medicine, you talk first about diet, 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 diet. It's a lot about diet, but it's about whole foods and plant predominant eating patterns. So you can eat different fruits, different vegetables, even meat, but it's eating plant predominant and whole foods. And what I mean by that is you could say that Oreos, for example, they're vegan, right? But they're not good for you if you eat bags and bags of Oreos. That's a processed food. So you don't want to eat that. You want whole foods, plant-based or plant predominant. Stress management. Autoimmune disease is odd that way, that stress can actually trigger the autoimmune disease. So you do want to learn, mindfulness. And I don't know that I even believed in this like 5 years ago, but yes, there are studies. It does help. It helps to learn. You have a stressful condition when you have myositis. It's a life-changing condition, but you have to figure out a way to, I would say, almost like live with it, work with it, so that when other stressors in life come, and it's hard enough living life nowadays without having an autoimmune disease. And on top of that, to have an autoimmune disease, you really have to be careful, and think about your stressors. Do as much as you need to do, but don't do more than that. If you have a big event, you do that big event, but maybe you can let go of some of the little things around it. Physical activity. We want you to live long. We want you to die of normal causes, regular people problems. And for that, the CDC recommends about 150 to 300 minutes of moderate intensity exercise. It didn't really make that much of a difference when you talk about heart disease, when you went from 150 minutes to 300 minutes. So it's okay if you don't do 300 minutes. Just work on 150 minutes of activity a week. And that's about 30 minutes a day, 5 days a week. So it's not as terrible when you think about it that way. Sleep is so important, especially because a lot of our conditions are surrounded by pain syndromes. And with pain, you will not feel better if you are not sleeping well. If you don't have restorative sleep, you will have more pain. It's just what it is. So sleep has to be controlled. If you think you might have something like sleep apnea, your partner is saying, "Oh my gosh, when you're sleeping, I feel like you're stopping breathing and you restart." Think about that. Get tested for sleep apnea. Those machines are not always comfortable, but they have new ones out. Sometimes they're a little bit better nowadays, but it can help. Sleeping is really important. If you're on your phone watching YouTube videos late at night, then don't do that. Do it during the daytime, make time for it, but get good sleep. It makes a difference. Avoidance of risky substances. And this means things like alcohol, smoking. I don't see any study that's saying alcohol is good for you. So if you drink, okay, that's fine. Drink in moderation, because it's not necessarily doing something favorable for your condition. But sometimes you need it with community, right? Or social connectedness, which is our next thing. So this is really important. And I have a lot of patients I've been following for a long time, and sometimes their spouses pass away and they're alone. And on top of that, they have this autoimmune disease. And already when you have an autoimmune disease, it's isolating sometimes because people don't understand maybe how to interact with you, what you can do that day, what you can't do that day, right? They don't know how to behave with you. And you may not feel like going out and being a part of things because you don't feel well. But that social connectedness, just, with the mind and interacting with another human being is really important. And I really try to push that, especially, living with these chronic conditions for a long time. It makes a difference. It's a positive connection. Next slide, please. So let's start with food, because that's always the most exciting part. But I'm going to tell you the negatives first. Things to avoid. Okay, processed food, you may have heard that. And what does processed food actually mean? It means that when you're looking at the back of a bag of something like bread, right? You go to the shopping aisle and you look at this bread and you turn it over and you look at the ingredients. And you're like, I recognize these two and I don't recognize any of these other things. Those are preservatives. Why should your bread have that many preservatives in it? So you want to be careful, and any food you're eating, check the labels and make sure you understand what is going into your body. Because if you don't understand those words, high chance it's processed. Sugary foods. Think about when you eat a donut or a piece of cake. Do you feel good? Now, some people know they have their triggers that if they're going to eat a lot of sugar, they're going to feel pain afterwards. And it may be like, it's worth it because it's Sunday, I'm celebrating with my family. I know I'm going to have pain, but it's worth it for my situation. Fine. But on a day-to-day basis, you don't want to have multiple sugary treats because there's nothing that shows that sugar, high amounts of sugar is good for you. I'm not seeing that anywhere. Fast food, going and stopping and getting fast food makes a difference. High fructose corn syrup. I was looking at my soy sauce bottle. I love using soy sauce for all these foods, and there was high fructose corn syrup in a lot of those bottles. So there's a lot of things in your food that you don't even understand is there. High fat food, same thing, because fat is actually inflammatory, and you certainly don't need more inflammation when you have one of these conditions. And preservatives and pesticides in your food. So read labels about those. Next slide, please. Microbiome. I don't know if everybody has heard this buzzword yet. Everybody's been talking about the microbiome. And what is the relationship with myositis? Well, actually, there is a relationship now for the first time. They're coming out with studies that show this. The microbiome is you have these trillions of organisms, bacteria, viruses, lots of things in your gut. And you have what we call good bacteria and bad bacteria. And you want to have a balance of them. Next slide, please. So they're finally doing studies with myositis and these bacteria and seeing how important they are and does it make a difference. Well, in this case, when they did this study, they actually found that there were certain bacteria that were associated with dermatomyositis risk. For example, and I may be pronouncing this completely wrong, the names are really long, the Rhuminococcacea genus. So this bacteria showed positive association with a risk of dermatomyositis. And the same with the Saturella genus species also showed a higher risk. Whereas on the other side, the Anerotrunchus genus, it demonstrated a negative association with dermatomyositis. Next slide, please. So we see that there are some that might be influencing myositis. There is something in your gut that could be influencing it. And they did another study, and this was also in 2022. So the other one was 2023. This was 2022. And they found in this one, there was two major points in this slide. I know it's a heavy slide, but the two major things was that patients who had dermatomyositis had less microbial diversity compared to healthy controls. What that means is there's all this talk when you look at the microbiome and you see it being suggested that we should improve it in many other conditions and in general for all conditions, that they say that having more diversity in your gut, more different types of bacteria is better for you than having just a couple. Having less diversity is bad. Well, this study is showing the same thing. It's saying in dermatomyositis, there was lower microbial diversity in people who had it. And then the second important thing in this slide is that, you remember we talked about those myositis specific antibodies? Well, they showed that those people that had the ones that are associated with ILD, which is the lung disease, those people, they had this distinct composition in their gut flora, and they also had lower diversity compared to healthy controls. So what does this tell us? Should we go out, buy probiotics right now with these particular, bacteria that they're telling us about, and maybe some will help dermatomyositis or polymyositis or IBM? Well, no, I don't think the data is quite there yet. But it's really nice to know that the studies are finally starting for specific myositis and what could be changed. Because I feel like we don't know yet if this is a chicken or egg situation. Do we know if it's because we don't have the right microbiota, the right gut microbiome? Is that why people develop myositis? Or is it the other way around? You develop it because you do have it. Next slide, please. So how do we improve our gut diversity, right? So that's what we're talking about. We want to have more diversity. Diversity is good. So we're going to increase the diversity of plant-based food in our diet because that's where we're going to get more of the appropriate type of bacteria we want. So we're going to consume adequate levels of diverse types of fiber, including prebiotics. And you want to have, if you've ever heard the term eat the rainbow, this is what it means. It means, no, don't just eat all red fruit, that's strawberries and cherries, and that's it. Well, those are good to eat too, very antioxidant rich, but you also want to maybe add some peppers, add some other things, do some variety in your meals. This way you can feed the different types of microbes so you have more diversity. Then you can try some prebiotics. Prebiotics are a little bit different. They're foods like whole grains, blueberries, bananas, leeks, artichokes, soybeans, garlic, onions. So one of my patients asked me this week, I heard garlic is really bad for you. And I was like, that would be terrible. I love cooking with garlic, and fortunately it is good for you. Next slide, please. So what is a probiotic versus a prebiotic? They're two different things. Probiotics, they're beneficial bacteria, but first of all, let's talk about prebiotics because they're the food for the probiotics, right? So we want to feed those probiotics. So when the bacteria get the food that they need, they can thrive with it. And this helps us with our health. So the probiotic are the beneficial bacteria. They're the ones we want. And you could find them in kind of live bacterial foods, bacterial cultures like yogurt, sauerkraut, kefir. You can also take supplements of probiotics as well. Next slide, please. So fermented foods. There's a lot of different fermented foods out there, and they're in a lot of different cultures. They kind of have a few of their own fermented foods. There's kefir, which is this drinkable, this milk product. Kombucha, you may have heard of kombucha. The only downside is very expensive, but maybe if you're out once in a while, and I don't mean drinking like multiple times a day, I mean once in a while, instead of getting a soda or a sweet sugary drink, you could try a kombucha. Sauerkraut, fermented cabbage. Miso, I do love cooking with miso. Yogurt, pickles, tempeh, sourdough bread. So sourdough bread is like something that a lot of people have heard of, and it's fermented bread. And that sourdough starter that you use is like this wild population of yeast. And actually, it's very good because it breaks down the food components like sugars, and you get this kind of different type of taste, maybe a little bit tangy, but it's actually better for your gut microbiome. Next slide, please. So what do these fermented foods, you've heard about them in a lot of different places, they suggest that these foods are more anti-inflammatory and could perhaps modulate the immune system a little bit better. So, for example, they took all these vegetables and in one of the studies, and they injected a particular type of bacteria called lactobacillus in them. And they found that there were increased levels of antioxidants, anti-inflammatory molecules in them. So wouldn't that be great if they could inject it into our favorite foods and we get the good stuff, the good bacteria from it? Next slide, please. So you have an inflammatory condition. You need to eat and you need to enjoy that food. So be creative, explore different areas, improve what you want to eat. And I know this is really funny, chocolate chip sourdough cookies. I had made them actually, and I gave it to my staff. And one of them, I didn't tell them what was in it because they may not eat it if I had told them. So I let them just eat what they thought was chocolate chip cookies. And it tastes really similar. I think they taste more like oatmeal chocolate chip, to be honest, but they were pretty tasty. And one of them said to me, I had this chocolate chip cookie. What did you put in it? I didn't have any bloating. And whenever I eat cookies, I always have bloating. And I was like, oh, they're sourdough. Now, everybody's different. I don't know that I've ever had bloating from cookies, so I never have thought about that. But there are different foods that affect different people. A lot of people have triggers to different foods. It's important to know what your triggers are because no matter what, everybody's is different. So I really highly suggest having a food journal. I know it's annoying, but there's a lot of apps out there. And when you have a flare of your pain, you're feeling just not well, think back to what you were eating 48 hours ago, 24 hours ago, and eventually see if you can find a pattern because not all foods will suit all people. And another example of that is when we hear about the Mediterranean diet, and I'm going to talk about that in a little bit, but in the Mediterranean diet, you have something called nightshade vegetables. And nightshades can't be tolerated by everybody. There's this component in their solanine, and that a lot of people feel triggers their inflammation. And so you want to be careful with certain foods. Now, is it everybody that has to avoid those nightshades who has autoimmune disease? No, some people can tolerate them just fine. So you have to know what works for you. Next slide, please. Fiber. I'm all about fiber. So dietary fiber, which is fermented by gut microbiota to make these short chain fatty acids. So these are good for you, the short chain fatty acids. This is what you want. So you want to get those and you want a diet rich in fiber because you get all this energy source for these colonocytes that you have. And you have, when you heard about leaky gut and stuff, you want to have more fiber in your diet so you can prevent the pathogens entering the bloodstream and causing any kind of inflammatory response. So I'm going to ask a couple of questions now if anybody wants to put the answer in the chat box, is what are some fiber-rich foods, do you know? And tell me how much fiber does meat have? Percentages are fine. Okay. Excellent answer from Annette. Meat is 0. And yes, apricots. Broccoli, yes, oats, very good. So you guys are good. Next slide, please. Flaxseed. So the answer is there is no dietary fiber in meat, fish, poultry, eggs, or milk. So don't count on those sources for your fiber. So if you're eating them, fine, but look elsewhere for your fiber. Apples, bananas, oranges, strawberries, they have decent amount, 3 to 4 grams of fiber, but a cup of raspberries has 8 grams. So think about this when you're eating. Eat well. Yes. Next slide, please. So when EULAR is the European Congress, it's the equivalent of the American College of Rheumatology, but in Europe. And we do share data with them. We look at their guidelines and we take them into effect when we practice medicine in America. They have something that they refer to as the RMDs, rheumatic and musculoskeletal diseases. And they came out and talked about lifestyle behaviors. But they talked about 7 of these RMDs. And what's missing from there? Myositis. Yes, it's not considered, there was nothing really guideline-wise in terms of lifestyle behaviors. And I think it's because there's still, I would say there's less data in myositis compared to, let's say, lupus or rheumatoid arthritis. But hopefully it'll get there now. There's so much interest in it, I think. But we have to extrapolate the data that they're suggesting for these other conditions and bring it over to myositis sometimes. Next slide, please. So other things to look for. Celiac disease. So there's a slightly increased incidence of celiac disease in people who have this inflammatory myositis, including IBM. And you would think, though, that treating with a gluten-free diet would help, but actually in some of the studies that they did, just removing gluten from the diet did not necessarily help myositis. So if it doesn't bother you, then go for it and eat gluten. But I will say one thing about that, and not everybody can tolerate all gluten, all breads, all wheat. So pay attention if it's your trigger, and it could be. If it's not that hard to check for celiac disease to see if you actually have an allergy to it. And if you think you might, then you should have it checked. But then there's also people who have sensitivity to it. And like I said, not all parts of wheat. So you try a food, and if you're fine, you're fine. But there may be a different one that it bothers you. But again, a food journal would be helpful here. Next slide, please. Vitamin D. So there's all this data on vitamin D and how having good amounts of vitamin D can help autoimmune disease. And in this Swedish study, they had reported that there was low serum vitamin D levels in myositis in their cohort. So did it help to supplement all these people and give them higher vitamin D? No, there was no real data to support this. So we want people to have good amounts of vitamin D, like proper amounts in level, but it's more to help their bones and more so that they don't have worsening of autoimmune disease, but it didn't necessarily make it better. Next slide, please. Oh, I'm sorry. And creatinine, I know a lot of people ask about that. That also was not helpful, nor was a high protein diet. Not yet, at least, in all these small studies that are done. So we have to keep a watch over them because myositis is affecting the muscle. So you would think that protein, high protein, creatine would help, but so far we're not really seeing much on that. So foods that mimic a statin, which is important if you have a statin-related myopathy, right? So there is red yeast rice as a supplement, and it's equivalent to a statin called lovastatin. So yes, that could trigger it. Oyster mushrooms, I love oyster mushrooms. If it doesn't bother you, that's fine. But if you have a statin-related myopathy, you may want to think twice about that. Some soy products and some grains. Next slide, please. The Mediterranean diet. So everybody's been talking about this. You've probably heard about this. And it supports extra virgin olive oil, vegetables, fruits, nuts, legumes, whole grains, and fish. You can have eggs and dairy and some meats and alcohol, but it limits it a little bit. And a lot of these studies, they're showing improvement, especially it's been suggested for the rheumatoid arthritis folks to do the Mediterranean diet. But like I said, some people can't tolerate everything in these diets. And so there's like the nightshades. So there's another diet called the ITIS diet that's being tested for rheumatoid arthritis. That's the population that they've used, but they've removed the nightshades for it from that diet. And people who had rheumatoid arthritis that were in this diet, their fatigue improved. You know, there's some like 50% of them, their inflammation improved in their joints. And so between fatigue and inflammation, nobody needs more of that if you have an autoimmune disease. So food is making a difference for some people. And it's supposed to be the best diet for cardiovascular prevention that we know so far. Next slide, please. So this was really interesting. It came out in February of this year, and it was a scoping study, meaning it was published in a journal and it was a paper, but it wasn't a systemic analysis. So we can't follow this quite yet, but it's interesting what they came out with is that people with myositis, maybe they should be on a diet like this. And in this diet, they had 15% protein, they had some creatine, fish oil, they had cocoa, curcumin, which is the active form of turmeric, 22 grams per day, green tea extract, and they had suggested all these fruits and vegetables to take also this kind of rainbow along with fiber. So this is not a diet that we necessarily have any data that you should follow yet, but it looks like maybe it may make a difference to try to find a diet that works for you and your muscles and your autoimmune disease. Next slide, please. So musculoskeletal pain and ginger. So now we're talking about the spices. So ginger, they tried this. They noticed in these marathon runners in 2013 that they were all taking anti-inflammatory medications even before they went running. And they were like, well, we know those cause a lot of side effects. People get gastritis, all kinds of problems with taking a lot of anti-inflammatories. Why don't we try ginger? and ginger as a compound. They used gingerols, and they used ginger extracts. So in this, they found that ginger was clinically effective compared to those anti-inflammatories, and they suggested having about a fourth to a half teaspoon daily. And we need more human studies to see if this helps. But maybe with pain and everything is not working, or maybe you can't take ibuprofen type of medications because you have kidney issues or something else, gut issues, maybe you could try different spices to see if that helps. Next slide, please. So does color matter in your food? And we talked about the rainbow, but in general, the darker the color of the vegetable, the higher the fiber content. So we talked about broccoli, beets, they're fiber rich, collard greens, Swiss chard. Artichokes are actually one of the highest fiber veggies, 10 grams for medium-sized ones. But don't forget the beans, because they're actually very easy to make and eat, much more, I feel, than artichokes. And they actually have quite a lot of fiber. So these are also, you can get them just, cooking them. But there's a lot of foods out there that are now fiber fortified. So you may want to check that on some labels too, if they're not super processed. Next slide, please. So fibromyalgia, this I think is really important, because when you have an autoimmune disease, fibromyalgia, or the pain syndrome, is not uncommon. And it's because, having pain tends to beget more pain. So if you're living in this constant state of pain from your autoimmune disease, it's not unusual to have fibromyalgia. Fibromyalgia itself is not an autoimmune disease, but it hurts, and you're always looking for ways to improve that. There is medication out there. We use medications, but to be honest, they don't work for everybody. There's side effects from them, and I don't have too many people that will say, I feel 100% better. And that's not necessarily even our goal with fibromyalgia. Our goal is really to improve, and feel better overall, but it's hard to go to 100%. So then you start thinking about different things that can be used. So they used ginger. It was used with Tylenol or paracetamol in a mouse model, and it was helpful. So that was a mouse model, not humans yet. But they found that because it's a potent antioxidant, ginger could help with pain. Then there was a study with capsaicin cream, if you've ever heard of that. It's the chili pepper cream. And they tried that for 6 weeks to show desensitization to pain, and that helped. And it also helped depression, actually, in that study. Again, a small study. And there was another study with magnesium, which I know a lot of people take, and amitriptyline, which is an antidepressant but often used for fibromyalgia. And the combination of those also reduced pain perception, because a lot of fibromyalgia is perception. It's not necessarily something wrong here. If you pinch it, and there's nothing really necessarily wrong, but the neurotransmitters are saying that there is something wrong. So the perception improved. But again, we need bigger studies, human studies. Next slide, please. So exercise and myositis. And I'll try to get this through a little quicker, because I know we need time for questions. But they had all these aerobic exercise protocols. There've been a lot of studies with myositis across multiple conditions. And they showed in a lot of these studies that the strength training, which we would theoretically be afraid to do, right? Because muscles are what's affected in myositis. You have breakdown of muscles, and you're worried that if you do strength training, then will you damage your muscles more? But actually, these showed improvements in muscle functions, and significant improvements, and people changed their kind of behavior when they did them. And they had better cardiorespiratory outcomes also. Next slide, please. Stretching, this generally doesn't hurt most people. Whether yoga is better, Pilates is better, or Tai Chi is better, I think the jury is still out. It's the one that works for you. That's fine to do. Next slide, please.
One moment, Dr. Bhanusali. I just wanted to let you know that since we started late, if you would like to go ahead and take your times, we don't need to rush. I don't have a hard stop. I just definitely want to make sure that we get to the questions, but I don't want to shortchange the slides. It's wonderful. Thank you so much.
I have no problem. But yes, I did a yoga study actually several years ago, and it was for myositis, and I had people in it with dermatomyositis, polymyositis, as well as some people who had like scleroderma with myositis. And I would say overall it was a very positive experience. Everybody felt better. The hard part of that study was getting people to come in to the office and do yoga. with our awesome yoga instructor, because you just don't feel like moving sometimes when you have myositis. So that is part of the problem. But everybody from that study definitely felt better, and some people continued it afterwards. But yeah, next slide, please. You have a lucky stretch therapist. Okay, Terry, I think that's great if you have one. And I would advise everybody to get one if you possibly can. I know not everybody has access, but it's great to have one. Strength training. So like I said, this is something we're scared about with myositis because it's breakdown of muscle. But you start low, you go slow, you don't go from, starting off at 10 pounds. No, start at 1 pound, start at 2 pounds, do what you can and increase in repetitions, before you kind of move on to the next level. Next slide, please. Movement. So this is especially important in IBM, inclusion body myositis, because of balance issues. And it's a little more difficult with that because it's asymmetrical. It's an asymmetrical process for the most part. And so not necessarily the same group of muscles is affected on both sides of the body. So that's also why balance can be off. Walking is a great place to start. Running, a lot of my people cannot do running, at least when they have active disease. But if you're in remission or you have mild disease, it's definitely possible. Don't let it hold you back if you're healthy enough to go, because you can do it. You may want to ask your team first if you're able to do running, but yes, don't let it stop you just because you have a diagnosis of dermatomyositis or polymyositis, because if you're in remission, we're hoping you're much better. Jump roping is tough to do for sure, but it's actually a great weight-bearing activity. And I want to put a plug in for weight-bearing activity because think of how much steroids your rheumatologist or neurologist or your specialist gives you. We give a lot of steroids. We know that, and we cause a lot of problems. Yes, so steroids save lives because it does reduce inflammation, but at the same time, it causes a lot of toxicity, and it's hard to sometimes get off of them. So we like to have weight-bearing exercise, but actually walking is a fairly good weight-bearing exercise. So if you can even do that much, that's wonderful. A walking pole for balance, yes, absolutely. That would be a great idea. Next slide, please. Okay, sleep and myositis. So there was a German study from 2020, and there was more patients that had low disease activity with better sleep than they had when they had fatigue and sleeping disorders. But sleeping disorders, are they common with myositis? Yes, it's about 51%. It's over half, a little over half of people have sleeping disorders with myositis. So it's not going to help. And part of it will be the disease process causing problems, right? I mean, you're uncomfortable, it's hard to sleep. And sometimes if you have to take a paracetamol or Tylenol to go to bed and you don't have liver issues or anything else, it may be something you need after several days of not getting good enough sleep. So you definitely want to, there are actually sleep specialists out there. It's kind of really annoying sometimes to go to all these different people. They're compartmentalized in their specialty, but at the same time, they know so much within that, so much depth, as opposed to you ask a rheumatologist about sleep. We know some things, maybe I know a little more because I love lifestyle medicine, but still we're not going to know as much maybe as a sleep specialist. So it might be worth it to see them if that's one of your big problems. Next slide, please. Yes, I can do that. Restorative sleep. So, common issues are sleep apnea, pain, which can disturb the sleep, or behavior like being up late at night on, Instagram or YouTube. All right, next slide, please. So aging and inclusion body myositis. We don't have any great treatments yet. I think all of us we'll talk to our patients if you want to try steroids or some other medications, IVIG. For IBM, we will try, but it doesn't necessarily work. So if it doesn't work, don't accept all the toxicities of those medications. And it may be that you just have to do more exercise because you have to keep what you have. So that's really important at this point with muscle aging. Next slide, please. Okay, so stress, we talked about it. Yes, it absolutely can. It can trigger autoimmune disease. So I know certain times when I know my patients are going to potentially flare is Number one, when they tell me they're moving somewhere, that packing of boxes, unpacking, it's a lot of stress actually to do all that. Even if you have movers that help you out, you have to think about where everything goes, and it's kind of a mess, and it can definitely induce a flare. Other times, divorces definitely can do it. So we know that stress can trigger autoimmune disease. So work with it, massages, relaxation techniques. You want to be careful with massages because sometimes when you have myositis, it's uncomfortable. But meditation, definitely worth it. Next slide, please. So get rid of this. This is what your cabinet looks like. Let it look like this for a picture, but I would not be going through all this. If you want to have a drink once in a while, it's fine. But definitely smoking is more associated with myositis conditions. So if you think about environmental factors, smoking is a toxin and it can be associated. Excessive alcohol also, we're concerned that it could be associated. Once in a while is probably fine. Next slide, please. So finally, social connectedness. This, like I said, is one of, I think, the most important things. I like this group. You guys have been chatting in the chat box, and I feel like, there's a lot of excitement and interest. And I love the fact that there's support groups. And I think that's so necessary with these conditions because it's really hard for other people to get you sometimes. Next slide. And so I did, as Rachel said, I did make a video with myositis exercises. And before you look at the video, I want to tell you, you don't have to do all of the exercises. Some of them might be too much for you and some of them might be just perfect. But consider trying these exercises, the stretching, and see what you can get out of it. You don't have to do to the high level. The weights in there are sometimes large because my model was, he can do large weights, but you don't have to do large weights. Like I said, you start low and you go slow. And what is important here is if you think that when you do exercise, your soreness is out of proportion to what it should be, that's fine. You need to get it checked out then. You need to go see a rheumatologist or a neurologist and be like, I don't know if my exercise regimen is making me worse. I think it might be. And it's not hard to check blood markers and inflammation, your CRP levels, your ESR levels. It's not hard to see, like even a CBC, sometimes platelets can be up if you're having inflammation. It's also another sign. So there's ways to check to see if that exercise regimen is making you worse. Sometimes it's not obvious, it's not on labs, and sometimes we do muscle biopsies. But another thing is that steroids, which we, like I said, give a lot of, they can cause a myopathy themselves. And I definitely have people where we're like, is it the fact that it's the exercise that's causing worsening symptoms, or is it the steroids that are causing worsening symptoms? And it's easy enough to check. So check it. If you think you're doing worse, check all this stuff, and if it's all normal, it also is comforting that you can go ahead with your exercise regimen maybe. All right, so you can check out, I made a video. This is, Rachel's going to send you the link. And remember, it's the little things that we do that can add up, right? We have medications. They're amazing compared to what they used to be, but still not amazing enough. And I want more, and I know you guys want more, but also work on the lifestyle. So whatever little part you can improve, it's worth doing so. Okay, so questions, I'm happy to take them.
All right, one moment. Okay, let me get myself back on the screen so I'm just not the voice of a higher power. But I'll get you started on your first question, and then I will be looking in the Q&A box. We've got several questions there, but we also had some that you submitted when you registered. But this particular one is wondering about aging and exercise. And I know that you talked about it a little bit, but this person's saying aging is stressful because exercise often hurts one or another muscle or joint. Sometimes I wonder if it's better not to exercise, but just do the things I need to do to live my life.
I know you can definitely feel that way, especially when you have to deal with myositis on top of regular aging, right? Which is tough enough. But at the same time, we know that like after the age of 30, you tend to lose about 3% muscle mass a year or a decade. And if that's the case, if you think about the time you get to your 70s, for example, you have lost a lot of muscle mass. And if you intend to get to your 80s or 90s, you are not going to have much muscle. It's all going to be replaced by fat, right? And what that means is that you could be doing little things like reaching into a cabinet getting a can of sauce out and you're going to pull a muscle. You're not going to be fit. So I know it's easier to not move sometimes because you have pain, but in general, you are losing muscle mass just from life and just from aging. And on top of that, you have it from myositis. So you do have to fight against that so you don't lose more, because you'll run into more problems. You'll just be more uncomfortable overall. And we all know that when you have less muscle and you have more fat, you tend to gain weight also, which doesn't help because the fat is inflammatory and you overall just don't feel good. And so there's a lot of buzz out there right now with the obesity medicines, and I know that wasn't the original question, with the GLP drugs and losing weight. And we definitely see people lose weight who feel better and they're able to move more. So if that's an issue for you, then I think that you can work with your physician to see if weight loss would help, if it's concerning that you can't move as much for it. But if that's not your concern, then I do think it's a good idea to get up and move in whatever exercise you can. You can do non-weight bearing if that's all you can do. Swimming, getting in a warm water pool can be helpful too. So yes, I think you should move.
Thank you. This person would like to know, can a person overcome myopathy?
So can you be in remission is the question, I guess, right? So yes, you can go into remission with dermatomyositis, polymyositis. There are people that have it, a decade ago, and there's often consequences. I don't think you are the same person after you have myopathy compared to how you were before you had it, because there was inflammation in your body. Maybe if it was caught early, and you got a lot of steroids, brought the inflammation right down, was put on a secondary agent right away, and the gods smiled on you and that medication worked amazing, then yes, you got into remission and maybe eventually off the drug and you're okay. But that's not the story for a lot of people, and they feel different afterwards. So yes, you can go into remission. Yes, you can stay in remission. It's not everybody, but some people can. Yes.
This person has a lot of pain with inflammation in their knees and wants to know if you have any thoughts on Omega XL and would it help?
Omega XL as a specific supplement, there's not really any validation with Omega XL as a supplement for helping knee pain. Recently there's been evidence showing maybe acupressure, actually doing self acupressure. There was an article recently on that, can help knee pain. Supplements that probably have more data behind them are something like turmeric or curcumin, which is the active part of turmeric, that has some data behind it. Ginger, like I said, has some mild data. If you do the hyaluronic supplementation, also has some data. I won't say it's amazing, but some people do feel better with it.
Thank you. Any link between IG therapy and leg cramps? This person has nocturnal calf and foot cramps, and for years and years, calcium and magnesium supplements and soap under the sheets worked for years, but not since they started IG therapy.
Now, I've heard that before, like headaches are common with immunoglobulins, and I've heard of cramps, but cramps is a tough one to get rid of. We don't have great treatments. Yeah, they were lucky magnesium worked. That's usually one of the go-tos. And in the old days, the quinine water, but you'd have to drink a lot of tonic water with quinine to help with the leg cramps. So there's not a magic pill, I wish, for that one.
This person would like to know, what is an integrative rheumatologist?
So it's the fact that we look at other factors, for helping a condition as opposed to just drugs. Because right now it's just drugs. And it's still what I prescribe on a daily basis, just drugs. But I want people to think about other ways to approach it. And so for my own patients, I've started making videos and I'm like, watch these videos and then let's talk about this. Because I want them to focus on other parts of lifestyle that we don't really talk about as physicians, because we talk about the medications. And they are great medications. We should take them. But wouldn't it be great if instead of taking immunoglobulins plus or minus methotrexate plus anti-inflammatories plus steroids, we are able to pare down that regimen? And that's, I think, the ultimate goal. You have this condition, it's not going to go away by itself most of the time. You will need medication, but maybe you don't need as much medication if you try to institute other things in your life and have them help you and change. I definitely have people who say to me, I'm ready. I see the inflammation going up, and I'm like, let's start this medication. They'll be like, no, doc, don't do it. They're like, I know what's the problem. Just now, I had this really stressful event in my life. I know I've been eating poorly, and that always does it to me. That's what lifestyle medicine is. It's knowing what has caused it and trying to see if you can improve that, to see if you can use less medications, maybe, or at least use different measures to feel better.
Thank you. Do you test for nutrient deficiencies, and what role does this play in disease?
So nutrient deficiencies is not something that we have a whole lot of a handle on. There are some deficiencies. Vitamin D is kind of the most common one that most people will test for. If people have other evidence of fatigue and, all your medications, your rheumatic medications are not making a difference, oftentimes we'll have them, see their primary care and have thyroid run, but also vitamin B12 and iron because it's often a culprit too. But the other nutrition levels, no, we don't generally check. There's functional medicine doctors out there that check it. There's not great data as to replenishing that will make a big difference. Like if I reference back to that vitamin D study, we were hoping that if you give increased vitamin D, that their autoimmune disease will get better. It didn't necessarily get better. So it's kind of like you take all these supplements and vitamins, but you don't know if it's helping you. And if it's not helping you, is it harming you? Is there an interaction somewhere with the other medications?
What is the role of CBD products in the treatment of myalgia and neuropathic pain symptoms? And why are healthcare providers reluctant to include these products as part of medication reconciliation?
As in terms of medicine, no, I mean my staff will tell me if somebody's taking CBD. That's not usually an issue, but for medical marijuana, at least you need to have a separate license. So a physician cannot just like I cannot just give medical marijuana to somebody. You actually need a license for that. But CBD supplements, I think most people are fine with. It's a question of, is it actually helping you? Somebody said to me yesterday, one of my patients, they're like, back in the 70s, I used to do plenty of marijuana and, it was great. And if I had some pain, it went away. But she's like, when I did it now, I got this CBD, I got all these things that they gave me. And she's like, it didn't make any difference at all. So I think a lot of this is, it doesn't help everybody. I think it does help some people, it definitely helps them, but it doesn't help a lot of people. And there's no real proof that it's helping inflammation. It does help some people with sleep and anxiety, but not necessarily inflammation. Every once in a while, I do hear from somebody like, oh, this cream, it's perfect for my ankle. It really helps it. That's wonderful. If that's what it does, then that's great. But I don't know that I see that it helps everybody.
Thank you. 1 second, let me get to. Have any of your myositis patients had any success with the AIP elimination diet?
So actually, yes, I have had some patients have success with that, but I will say it is a very tough diet to kind of maintain. All of these diets that are kind of on the one extreme are hard to maintain. And I know one of my patients just lost too much weight. I was like, she's like, I feel good, I do, and I was like, yeah, you've lost so much weight, and she was already thin to begin with. And at some point, she's like, okay, well, I can't do this anymore. And, she lived with it, but, she takes her Cellcept and she doesn't need high amounts of it. She's still like, has cut out a lot of the things with the diet that she knows really bother her, but she doesn't cut out everything. But yes, I have seen some success in people. It's just hard to manage.
Can regular e-stim be beneficial for myositis, not in place of exercise, but perhaps in addition to? Can machines for home use be effective?
E-stim?
E-stim, that's electronic stimulation, I think.
Okay. I mean, there are some people definitely that feel benefit from that.
Sorry about that.
That's okay.
I'm at the office
Definitely.
and they want to vacuum, and it's probably not a
Oh,
good time for vacuuming. So we just roll with the punches here. Are
yes.
you
No,
ready for
no
your next
problem.
question?
I mean, I definitely have people who get these devices, from their physical therapy offices and they try to buy the devices at home. And some people find a lot of relief with them. I don't think there's a standard device that we would suggest to everybody, but yeah, I would work with your physical therapist and see what they recommend and if you can use a home device.
Do you think vagal nerve stimulators are the same thing as the e-stim I just mentioned? Or is that
I don't
something
think I know
different?
enough about that. I can't say
Yeah,
I've
we
done
had
a lot of
another
research.
question about that. So, can you overdo the probiotics?
Yeah, I mean, I think you can't overdo good food, but you can overdo probiotics. And if they're not helpful, then they're not helpful. So how do we know? Like, I talked to you about those probiotics and prebiotics, but how do we know that those probiotics are really going to make a difference in dermatomyositis? I think overall, any gut specialist you ask will tell you eat better. Yeah, you could take the supplements, but the data is really not like saying you should take the supplements and your disease process gets better.
I had a question about probiotics about, I see them in the stores, but I've also heard that just because it says that probiotics is in there, the label says it doesn't mean that they're live. Do you have to
Mhm.
make sure that there's live probiotics?
Well, I think it's preferable, but if, you know, I guess like when I talk to the gastroenterologist, they're kind of like, yeah, we don't know if these really help. I would do live, bacterial cultures. I would do live cultures in foods instead, like yogurt or kefir. And they have more confidence that that'll be helpful than the probiotics that are in, even like the VSL and the other ones that they suggest for inflammatory bowel disease. That's the only one that I think that they're like, okay, that may help inflammatory bowel disease. But otherwise, I'm not seeing them kind of tell us, you should definitely take this particular probiotic, and it'll help everything.
We have a couple of questions about sleep, and then unfortunately, we're going to need to wrap up for the evening. This person has a very difficult time getting restorative sleep. They
Mhm.
awake in pain many times a night. They do feel better when they get a good night's sleep, but it's very rare. They don't want to take sleep meds. Do you have any other recommendations?
Exercise. It can tire you out. Absolutely. But yeah, no, there's actually like, I mean, the sleep specialists don't think they can't be helpful. I think it's worth a visit because even your food, I mean, there is a difference with eating a protein-rich meal at nighttime right before you sleep versus a carb-rich meal, having that 2 hours before bedtime versus at lunchtime or switching that around and how it helps your sleep cycle. There's actually a lot of psychology to sleep that we don't really talk about because I think the sleep people know it the best and I don't like to encroach on them. But a little bit we can
Do,
suggest.
do you have any concerns about 1 milligram of melatonin nightly to help sleep?
I don't particularly, but they don't generally like too much melatonin. Like, if you look at the sleep data, even when you're flying across the world and they suggest in order to balance your sleep before you reach your next destination, they only suggest like 0.25 milligrams. So it's actually a very small dose. And yet what you get in the pharmacy is like 5 milligram tablets or 10 milligram tablets. So probably 1 milligram isn't a big deal, but actually the sleep people will tell you otherwise that maybe it's better to be even less than that.
Well,
But
I
yeah,
want
so it
to
was.
tell everyone that we did have someone, I think from University of Central Florida, come in and speak to do a webinar on getting a good night's sleep. And that is available on our YouTube channel. If you'd like to go there and just search sleep and you can find it. And hopefully you can be sleeping better soon. So that's all the time we
Yes.
have. Thank you to Dr. Bhanusali for her time today. As a closing reminder, this is Myositis Awareness Month, and we hope you are out in
Mhm.
the community spreading the word about this rare disease. You can access our awareness toolkit on our website, and that's myositis.org. And please tune in to tomorrow's program, Amplifying the Voice of Myositis Patients at FDA, applying patient advocacy to advance rare disease research in government agencies. TMA and TMA Women with IBM Affinity Group is presenting this. And we're very excited to share this program with you, and that will be tomorrow. And then what else do we have? Oh, the questions that we couldn't answer tonight, please bring them to our next Ask the Doc with Dr. Tassine Mosafar. That is May 22nd, and he can answer questions about every single type. So, and then also when I close this and say goodnight, if you could please fill out the survey, we would love to have your input. It will help inform future programming. Thank you again, Dr. Bhanusali. We really appreciate
No,
you.
yeah. Thank you, and good luck to everybody. And yes, watch the sleep video. It's very important.
All
Take
right,
care.
thank you. Good night.
Bye-bye.